Hello YouTube family and welcome back to my channel. Thank you so much for tuning in. My name is Posy for those who don't know already. We are officially on day 29 in South Africa of lockdown. We've been in the house, we aren't able to move, we can't do anything, we can't go anywhere, we can't see our friends, our parents, our family members, our lovers. You know, it's been a very interesting time, but here we are. We've done almost 30 days. I mean, tomorrow is 30 days and we've made it. So shout out to all of us for managing to follow the restrictions, to listen to law enforcement and public officials. We are going to win this war against coronavirus, COVID-19. Yeah, so welcome to my channel and I really look forward to our chat today. I'm picking up from where we left off in my previous video. Yes, it was very intense. It was very, sad. But I think it was a good experience for me to just let it all out. So today, again, I want to do part 2, how to deal with grief in the period of COVID-19. For this video, I want to do things a bit differently. I'm going to be giving you pro tips on how to actually engage someone who is grieving and the do's and the don'ts and how to interact with someone who has recently lost a loved one, whether it's due to the coronavirus or from any other circumstances during this very difficult and dark time. So please stay tuned and I hope that you will find these tips to be useful in terms of how you interact with others with sensitivity and patience, and let's get through this, okay? The first thing that you need to remember when you're dealing with somebody who is grieving is what they really need is a friend, right? Don't try and be a therapist or try to be deep or try and be profound or say profound things, when you are going through a difficult situation, which is what I found, is that sometimes you just need someone to listen, or you need somebody to just sit there with you and not even say anything. And if the person that is grieving is not particularly talkative or wants to express themselves, then maybe they just want you to just sit there with them quietly and just be in their presence, or on the phone, just have that moment of silence, depending on, the nature and the relationship that you may have with that specific person. I do know that there are people that I can just sit comfortably with in silence, like one of my best friends. We don't need to talk. We don't need to always fill up the space with words, and both of us are definitely like calm, relaxed type of people, so it's easy. Sometimes you just need to read the situation and know what does that person need at that specific moment. Just be a touch on the back, or obviously you have to be appropriate. It depends again on the nature of your relationship. If it is a friend, then like I said, you can sit quietly with them, you can listen, you can hug them through, allow them to cry, let them express themselves the way that they want to. And even when they do cry, don't be afraid of tears. Tears are a normal expression of releasing. It's an outlet, moves the tension that is within. So allow people to cry. I know sometimes it may be uncomfortable. If you're in an office setup, then maybe you can excuse yourselves, take that person, put them in a boardroom or in a private space. If you're at home, then I suppose then you're free to just express yourself the way that you want. At any place, at any location within the house, at any room in the house, a person can be free to just release and express. But don't be uncomfortable when somebody cries, especially men. Just let the feelings come out, let the release happen. You will find that sometimes you do come out lighter. You need that release. You just need that outlet to get all those emotions that are pent out, that are confusing, that are in conflict with each other. Just let them all out. This is the season with the whole coronavirus. People are sick. Other people are dying. People are losing loved ones. It is a moment in time for tears. So allow the tears to fall. If you feel like you want to be by yourself, like myself, and you just don't want to be publicly showing emotion, then that's okay too. Whatever works for you, go with that. Where possible, offer your support. I know we can't attend funerals now. We are still on lockdown, and there's major restrictions on who can attend funerals, etc., etc. But where you can, send a text or send a message every now and then and again. You obviously don't want to bombard the person that's grieving constantly, sending messages or calling them. Again, read the situation, use your intuition, but avail yourself to the person. If they don't respond, they'll respond as and when they are ready to speak. So allow them their space to do what they need to do, to feel what they need to feel, without you feeling offended or taking it as a form of rejection. It is just the process that they're going through. It's normal, and I'm sure once they feel better and they're able to communicate their gratitude, they'll let you know at a later stage. So never stop showing up for the people that need you during their process and this period of grief that they may be going through. The other thing to consider are cultural differences. We are all different, so you need to keep that in mind when you are interacting with somebody that is grieving, that there's certain rituals or cultural practices, things that need to happen in a specific way. So be mindful when you are talking to somebody or comforting somebody who is actually grieving, not to offend or overstep, but rather educate yourself on those different cultural practices. It will help to make the situation easier and less uncomfortable. And I'm sure they will also appreciate the effort and the care that you are demonstrating as they are going through a difficult period. Obviously, once time has passed, it's been weeks, it's been months since, your loved one has lost somebody important in their life. Be comfortable enough to bring them up in conversations. It shouldn't be an awkward situation where you cannot speak about the deceased. It should be a normal progression that you talk about that person. Remember the good, remember the positive memories, speak about them. Let it not be a situation where it's awkward or uncomfortable when you are talking about the specific person. And if they did die tragically, remember the good. Don't dwell too much on how they died, but rather focus on their life, the memories that you share with them, the good, and don't dwell too much on the pain. And it's easier said than done. Like I mentioned before in the previous video, it's easier for me to say these things, but I think what definitely helps is to keep the memory alive by speaking positively. If they have other loved ones, children that they've left behind, a spouse, bring up certain memories that you may have. If the situation obviously allows, you can talk about, some of your positive experiences that you've had with them or memories. Remember them in a good way. So remember anniversaries, birthdays, all those important dates. Christmas can be hard, New Year's Eve, big holidays can be very difficult for those that are left behind. So check in on them, make sure that, you can even set up a date or an appointment and do something on that day if they do feel up to it, so that they're not alone and overwhelmed with emotions and sadness and misery on those, very pivotal moments in time. So be available, remember them, put them in your diary, document them, and avail yourself to those that will need comfort during that time, even after the funeral, months, weeks, years later. They'll really appreciate it. Which then leads to my next point, in that be available even months after the funeral has happened. There's nothing that beats comfort and the support of other people. Most, I think, difficult part about grieving is the sense of loneliness. There's that gap, the person that, the person is no longer there, so you're feeling the pain and the agony. So it's important that you remember those that are grieving and that are left behind, and visit them and talk to them and cook for them and take them out and text them. Sometimes they might not respond, maybe they might feel annoyed, but you as the person that is there to offer support should be there to show your support and not be offended when they don't respond in the way that you expect them to respond, but also make sure that they know that you are available, so that when they are ready to talk to you, then they can come and approach you and talk to you in their own time. So allow people to work through their feelings in their own way, in their own time. this is an individual process. There is no set way, there's no set time, and there might be an expectation that after a year things should be better or so on and so forth, but there is actually no timetable to dealing with the loss of a loved one. So be patient is my next point. Be patient with the bereaved, and understand, that they are going through a very difficult time, and it is going to take an extended period. It's not something that losing a special person is not something you can get over like that at a click of a finger. It's time, because you spend time with that person. Be patient with their emotions, be patient with their mood swings, be patient with their responses to you. They may not be perfect, but they will come out on the other side and things will get better. But you have to be the rock and assist them where they can't, because they're having blind spots at the moment. Don't change the subject when the bereaved brings up their loved one in conversation. I've mentioned this before. It should not be an awkward conversation. Let people talk about their loss. Let people talk about what they're feeling at that moment. It shouldn't be awkward. It shouldn't be something to be afraid of or to try to deter away from. Let the person's name live. Let it be something that, let it be a name that can be mentioned without fear of repercussions or anything like that, So don't change the subject. Don't look away when somebody mentions the name of the bereaved, or even feel like, oh my gosh, here we go again. Allow people that process. The don'ts, which are also just as important as the do's, is don't downplay the pain that the bereaved is going through. Don't downplay or try to trivialize their loss just because they're not a family member, or you didn't see them to be as close as you think that they are or should have been, or the circumstances regarding the death or the relationship may have degenerated when the deceased passed away. Just play your part, be supportive, be kind, without judgment. People grieve differently, so just because someone is not crying in the boardroom, or they're not wearing a long face in the office, or they are posting pictures on Instagram and they're looking happy and they made up and they look like, oh my gosh, they're okay now, they're over it. That doesn't mean that they're not in pain. So it's not an opportunity for you to be judging or trying to, project your own assumptions again into the situation. Let people express their mourning in the way that they want to express it. Some like to be silent, some isolate, some might want to be in the presence of other people. It's different for different people, and the duration is different for different people. So allow people to grieve the way that they need to grieve, and be able to be ready to adjust to their responses as far as their grief is concerned. And the last part of the don'ts is do not be afraid of their suffering. Grief is a very deep and intense thing. You've lost a loved one. You will never see that person again. Some people fall into depression. People get sick. It's a psychological, emotional, mental fight. It's a battle. So do not be afraid when people get sick or get ill. It's part of the things that need to happen for them to get through. But be available to offer support, offer advice where requested and needed, and be a support and be, again, available, and ensure that you let them know that you are there for them. You are a listening ear. You can provide consult regarding certain treatments that they can look into, obviously with the guidance of a health professional, but do not be afraid and avoid them just because they're down, they're sick, they're depressed, they're ill, or they're in hospital, or whatever the situation may be. And then things not to say to somebody who is going through grief or is bereaved is, God doesn't give us anything we can't handle. Not an appropriate response in a situation like this. It's probably for the best. Death is never for the best for the person that has lost a loved one. I know how you feel. You may think you know how the other person feels, but you can never really know what somebody else is feeling. You know, like I mentioned, we're all different people. We all experience pain and grief in different ways. So keep that in mind when you are attempting to counsel someone who is grieving. Never say, get a hold of yourself. Your loved one wouldn't want to see you like this. That's not appropriate. Or with people with children, never say, at least you still have, mentioning the other child's name. Everybody plays a different part in people's lives. If I was a mother and I had 3 kids and I lost one child, I've lost a child. So to say that the other children are going to fill up that space of the one child that I've lost is not the appropriate response to be communicating, because that is a specific life, that is a specific person. There was a specific bond, that is between mother and child, or whatever the relationship may be. So never say anything to that nature. And to add to that, never say something like, you can always have another child, or you can always get married again, or you can always... No, that's also not how you should handle somebody who is going through grief. At least it was a good way to go. Maybe that person died in their sleep, or they died peacefully. At the end of the day, that person is gone, that person is no longer, and the pain is still the same as somebody who was in a car accident, or somebody who was sick, or somebody who, came upon a specific tragedy. I think what's key is just to be there, be a listening ear, avail yourself, and give that person the space that they need to feel what they need to feel, and go through the cycle and go through the 5 stages. And they will call upon you when they need your help, and when they do need their space, give them their space. So I hope you're keeping well. I hope you are staying safe. Wash your hands. Let's continue to follow the regulations so that we can get through this and there's no more loss of life that will be experienced because of COVID-19. And if you have lost somebody special or important, so my thoughts and my prayers are with you. And I pray that you will get through the situation and you will find strength to overcome through Christ. Have a good day. Bye.